Talk to me a little bit about what it feels like right now with the COVID-19.
In the time of COVID, it's been interesting. I think for myself as well as patients and even the residents at the nursing home, life changed basically overnight. And I think there was in the beginning, like when I was doing my support group and things, there was a lot of people were scared and nervous and what is COVID and what's happening. And for a lot of caregivers who were able to take the person, their loved one or the care recipient to an adult daycares were closing. And so for the first time, they were having to figure out overnight, am I staying home? Am I reducing hours? What am I going to do? Other people had their loved ones in nursing homes. Nursing homes were going on lockdown. They had no way to talk or speak unless they called over the phone, or to know what was going on unless newsletters were sent out. So I think it was a very, very difficult time. And then I'll end with that lastly, where some of the challenges ended up really being about, now I'm with my care recipient 24/7. There's all this time, what do I do? And so we spent a lot of time really thinking about activities that they could do and how to take activities from the outside and bring it into the home. And then also in the nursing homes and as providers, we started using telehealth. And so how did we still do everything we needed to do as you and I are doing now? And honestly, great things came out of it and it worked great. In terms of the intergenerational caregiving, I think Hawaii is unique. This is one of the few places where we have 3 or 4 generations living in a house at one time. Not always, but it's very, very common. When you move to the mainland, it's not common to see that many generations in a house. And these conversations are now starting to expand, but it's really looking at, there's different things with this. One, there's a cultural aspect from maybe the way your grandparents think caregiving should be, or how it should be to your parents, to you yourself, if you have children or younger siblings or nieces and nephews. And we see difference in generations over time. And so we see a clash sometimes in the house about who should be doing what or how it should be done, or the respect factor, or what ancillary services are we going to let into the house. And for a lot of the older ones in minority cultures, you don't talk about this. You don't share it. You don't let other people in the house to take care. It's for you to do. And in Hawaii, depending on the culture, sometimes the firstborn or the younger ones don't help out. It is only the spouse. And so families really have to come together and really figure out, how exactly it's going to be done. And there's no right or wrong way. And every family has their own dynamics. And I think us as providers and the therapists, if they are similar support groups, are other great places for them to reach out and really figure out how to pool the family and the resources together to support not only the person with the disease, but whoever's going to be the main caregiver or sharing in the responsibilities.
Thing is, I know there's a lot of different resources and exist all across the country, right?
Yeah, so we'll definitely, going to your website for caregivers in COVID-19, your community is the perfect one that can be used nationally across. I want to point that out first. Also, there are, of course, organizations like the Alzheimer's Association, which is a national, very big organization that has built a lot of resources for the caregivers. There are also training programs for caregivers that I don't think many caregivers are aware of, such as the Savvy Caregiver Program, which again is national, evidence-based, very good comments and feedback from many caregivers. I've been through it. I'm a facilitator for it. It was one of the best things I've ever done in my life. Also, the Dealing with Dementia for the Rosalind Carter Institute. And then every single state has an ADRC or an Elderly Affairs Department, and so that's always a great place to start to reach out to find resources.
I'm really glad you mentioned ADRC because the national organizations kind of give information that is generally true, but the ADRCs are where they're going to have information about what's available locally. Mm-hmm. Thanks so much, Poki'i.